Is there a specific age limit to pediatric clinical trials?
It does vary from trial to trial. There are some trials that go all the way down to birth in terms of the youngest age, and some trials that actually span the entire age range that go from birth all the way through, elderly adult patients. For many of these trials, eligibility is 1 or 2 years of age, but it depends on the specific trial. But for these pediatric trials, most children would be eligible. Age is not generally something that excludes patients from these studies.
Okay. And how would someone go about getting their child enrolled in a clinical trial?
I think that's a great question. And just one thing to add to Dr. Laetsch's prior answer is that not only is age a factor, but all the other clinical parameters of a child's cancer and how they are and their liver function and kidney function and everything gets taken into account. So it's why you need a good center that can evaluate you, and whether you get there through your doctor or from Massive Bio or another similar group, you will go through a doctor screening process where they're going to look at all the parameters and or Massive Bio's algorithm, and will say, based on your function, you're this, you're that, you are or are not eligible. And it can be often frustrating because there are very few slots on many of the clinical trials, and it could be one little number, or your kidney test is just out of normal range. And so that could make you eligible or not. So just something to be aware of, that once you identify a trial, there are some steps that need to go through as a family or as a patient, and Massive Bio can certainly help, as well as your care team. I think getting involved in a clinical trial depends on what is the clinical trial for. And I say that because Dr. Laetsch told us that sometimes clinical trials are not just for relapse or progression, they are for the minute you're diagnosed. Clinical trials are the way we get information and develop standards as to how to treat children. And the treatments we have today harken back to research that was done in the 60s, 70s, 80s to know what is the right therapy for a child. And so I want families to understand that just because you're being proposed to go on a clinical trial does not mean you have advanced cancer, doesn't mean you have progressive or relapsed cancer. You may be on a trial where they're looking at whether 8 milligrams or 9 milligrams of the same known drug that helps a cancer is better or worse. And so one shouldn't be fearful of a clinical trial. Again, many pediatric cancers, unlike adults, are treated on a trial. And why is that? Because we need to pool patients together to get meaningful data. In the adult world, there are thousands and thousands of patients with cancer, unfortunately, but it's true. And so getting data about what works and what doesn't is much easier. In pediatrics, the numbers are so small and cancer is so rare that the only way to know if something's working or not is to pool numbers from various centers. And so clinical trials are the infrastructure to do that. So again, working with Massive Bio to screen your child and help you find a center that has a trial open, or your own care team back at home, they can certainly do that. But really using the tools, your genetic testing, your clinical picture, the genomics, sort of the course you've had so far and the response to treatment that you've had so far, all factors like this really are very important to determine what your next steps are. And if it is a clinical trial, there are the options, and should definitely talk to your provider about it, but there's ways to get on those trials.
Yeah, that's great. And it is important to mention, I think, like you said, there's unfortunately a misconception, regarding clinical trials. In this day and age now, there are so many advances that, you could be receiving, a life-saving therapy, or, something that, is used to help treat others. It's just, they're very important to everyone. And, we certainly want everybody to have that opportunity. And like you said, you can get these information about clinical trials through your local provider, or you can reach out to Massive Bio, and we can, work with you and your provider to provide you these options.